So we're back today with another talk by the water cooler, and today we're going to talk to Tom Ransohoff. He's the technical head of biologics at Resilience. For those who don't know Resilience that well, could you tell us a little bit about what you do?
Sure. Resilience is a company that's a little over 2 years old, and we were really founded with the premise that biomanufacturing hasn't really kept pace with advances in science and biologics. So our mission is to use technology to build better biomanufacturing platforms for a wide range of biological chemicals and products.
So the degradation of biomolecules is a trend that we have been discussing a lot. What would you say is driving this trend?
Yeah, we actually are working in all of the major modality areas, so cell therapy, gene therapy, nucleic acids, biologics, and vaccines. And so we do a lot of work with newer modalities and newer product types. And, in terms of what's driving that, I think it's that as the science has evolved, we've realized we can solve medical problems that we couldn't solve with products that are more mature, like recombinant proteins and vaccines. So the prospect of cell and gene therapy and nucleic acid to really provide cures to diseases that aren't possible with current modalities is one of the things that I think is driving the explosion of different product types that we're seeing in the industry.
So as a manufacturer, what new challenges is this diversification posing?
Yeah, and I think for us and everybody in the field, one of the major challenges is that these newer product types and modalities are very complex, and so the manufacturing and analytical processes that we use to make and test the products are very challenging technically, and this really drives the need for companies like Resilience to invest in new technologies to develop better ways to produce and control the quality of these new medicines and modalities. And that's exactly what we're doing.
Yeah. So if you would look ahead into the future, let's say 5-10 years, what's next? Right?
Yeah, I think it's really exciting. I've enjoyed working in the biopharma industry for my entire career, and I think it's exciting to see that the industry is still very vibrant. And I think, 5 to 10 years from now, we'll see a more agile pharma industry. We'll see an industry that leverages digital technologies a lot more. And we'll see an industry that is not just making blockbusters, but also making products for niche markets and even personalized medicines, while we continue to develop the ability to, make more complex medicines for large indications and populations, which is part of what we're working on in the biologics franchise.
So if you instead will look back to the first day when you started in this industry, what would you say have been the biggest development?
Yeah, we often give ourselves a hard time for not adopting new technologies, but when I look back at starting in the 80s as a chemical engineer working on some of the earliest monoclonal antibody processes, I realized how crude those processes were. We were actually purifying antibodies from murine ascites fluid using very crude SDS page gels to analyze the quality of the products that we were making. And when you look at the way antibodies are made today, it's really an incredible evolution from that point forward. And I think, what's exciting to me with these new modalities is we're kind of in that state now with a lot of the new modality areas. And I think, the next 20 to 30 years will bring about, further advances in how we make these more complex medicines. So I'm excited to see that and hopefully be part of it for at least a little while.
Well, thank you so much for joining us today.
Yeah, thank you, Anna.
Thank you. Bye.
Bye.